Hey, it's Jessica DaMassa with WTF Health, and joining me right now, I'm very excited to talk to this lady. This is Jane Sarasohn-Kahn. She is a big thinker, an advisor, a health economist,
That's right,
and an author. And
That's
so show
right.
everybody the book. Here it is.
HealthConsuming by Jane Sarasohn-Kahn.
Yes, find that on Amazon now. All right, but we want to pick your brain. You got the book with us, and it's all about the consumerization of healthcare.
That's correct.
Give us a state of play. Where are we right now in the consumerization of healthcare?
So right now, the technical term is that the consumer is getting screwed by the American health system. And that is because the consumer, the patient, has become the payer. And as a payer, handling first dollars in health and high deductibles, increasing specialty drug costs, maybe 50% of the retail price for specialty drugs in some health plans. Consumers have to pay, but they don't have the consumer tools to use to be real health consumers. So by the end of the book, I call for the second part of the recommendation, which is to morph from health consumers to health citizens.
Okay.
And by that, we have a call for, in the rights column of rights and responsibilities of a citizen, the right to affordable, accessible care universally. So I call for universal health care. I don't say the type. I just say, does America want everyone to have access to health care or not? And number two, a privacy law that goes beyond HIPAA, like the GDPR in Europe, which is an opt-in system versus the opt-out that is HIPAA, GINA, COPA, and this patchwork quilt we have. In the middle, from the beginning of the book, from patient as payer to that health citizen sort of holy grail, we talk about the role that Amazon has played in priming health consumers, where we now know what good retail looks like. We could shop at Nordstrom, the Wegmans grocery store, Patagonia, REI, any number of companies I call out in terms of the role models of retail experience and good design. And now, as health consumers, we want that same experience, not just patient experience, but consumer experience. And that means we're feeling respected. And if we feel respected, we actually have better outcomes. So I connect to real data. There are over 500 footnotes in here from JAMA, New England Journal, research papers that point to the fact that a more activated patient costs less money, and that includes costs less money to me, the consumer.
Okay, so even to themselves.
Even for themselves. If you engage in health, have healthy lifestyles, and then you also become a role model for your kids, for your parents, for the people in your network. And we know from the research from Nicholas Christakis and George Fowler in their book Connected, what you do in your social network, whether offline or online, impacts the social networks of your peeps and the social networks of their peeps. So if you're a binge drinker, someone in your network is a binge drinker. If you quit smoking, though, someone in your network is going to quit smoking too. So you can create this virtuous cycle. Anyway, all those themes are wound up in the book with a whole chapter on digital health and retail health as
Oh my
well.
God, so much. I have so many things I want to ask you.
Like easy to read, a short book.
Yes, it is. Okay, so I want to back up to one of the first things that you said. I want to back up to what you said about the healthcare consumer and how this is not real consumerism because we're not given the right tools. So expound upon that for me. Explain what is missing in the healthcare equation here where this idea of consumerization is just not right. It's not the proper definition.
A couple of key things that are being discussed now on the campaign trail. We're in 2019 now, so we've got a lot of discussions about health reform. Number one, transparency. Transparency of prices, since we are exposed as patients/consumers to that first dollar in a high deductible or again to a prescription drug at the point of purchase retail. What is it going to cost me? Do I know ahead of time? Like I do when, say, I go to Amazon and do a search. Can you imagine if you go to Amazon or elsewhere and you type in arthroscopy and your zip code and you get a list of orthopedic surgeons who bundle a price that's consumer facing for arthroscopy, but you also get other patient reviews like Yelp style or health grade style for the doctor, and you get price and value all on there. And we know from various studies that consumers trust tech companies as much as they now trust health providers to help them manage health. That came out of a study in the book from PwC's Strategy and Group a couple years ago.
Okay.
Well, when I show that data to state hospital associations where I do a lot of speaking, the hospitals are saying, but that's my business. business. My core business is helping people manage health, but consumers say, I don't know your value proposition, how much it's going to cost, and frankly, the consumer experience is not up to the retail experience I expect as a payer.
Right.
So transparency, tools, and the other issue is privacy, which I just mentioned. How are we going to protect people's data? The more we wear these devices, I've got a few things on. I'm generating data as I stand here and getting Walgreens balance reward points. Not to plug Walgreens, but I get another benefit from measuring myself, quantifying myself. But what is that going to do for me? That data is in a cloud somewhere, and by signing onto the app, I'm allowing it to go to third parties who may or may not be working in the context of health. And that's the way the FTC, the Federal Trade Commission, is looking at data out of context. We don't have regulation on that yet, but that's what I'm talking about. There are all kinds of articles lately from New York Times to Trade Press on how, say, women's menstrual tracking data is showing up in Facebook. What is wrong with this picture? Everything. So we can't have real health engagement. We want people to share data for good, be data altruistic, and at the same time protect people from having their data used out of healthcare context. And right now, that is not how it works.
All right, you had brought up the big tech companies, and you brought up digital health, and you said you addressed digital health in the book. I'm curious, you weighing in on this, is digital health making things better or worse in terms of moving us from this idea of health consumer, which is not real, to health citizen? Is it helping or is this hurting?
Yeah, well, it's a double-edged sword. I hate to hedge. We economists say, on one hand this, on the other hand. We're known for that. We have to hedge on that. There's going to be a presentation here tomorrow from my great friends Devin McGraw at Citizen, who used to work at the Office of Civil Rights, HHS, and Vince Carretas, a longtime digital health guru at this conference. And they have a session on the Goldilocks effect in healthcare. How much, to share or not to share, how to right-size sharing. And that's really the question that we're addressing from the data privacy point of view. From digital tools, there are some that people find useful. Certainly health tracking can be, if we really listen to it and don't throw the item in the drawer after 3 or 6 months, which most people still do. But this morning we heard, for example, Ben Wanamaker from Aetna, which is now part of CVS Health, and that was approved a couple weeks ago by the district judge, who said, yes, indeed, you can go forward and marry. So that is a real thing now. And what Ben talked about, just as an example, was their Attain app, part of Aetna, where people can score points, but also really pushes AI-driven information based on your preferences, your claim, because now with CVS and Aetna, we can put all that data together, the personal generated data, patient-generated data, and claims data, and all of a sudden soon we'll be able to make some magic with real personalized recommendations that aren't just the stuff that's coming out of my watch right now, but that are really personalized to me, how I eat, and maybe in the future, even my gut microbiome. And tomorrow I'm interviewing Josh Stevens from Day 2 on the big stage, talking about Day 2's microbiome longitudinal data, which can inform your nutrition based on your poop, I think is the technical term.
Yes, that's right.
Yes, so there we go.
All right, so let me ask you this, last question for you. You're an economist and an author. Weigh in for me. Are you, all is said and done, are you optimistic about how things are going to turn out? Do we really have a shot at becoming health citizens, like you say? How contingent is that upon the election? Or do you think that eventually there's going to be so much empowerment among people that they won't achieve real consumerism, but eventually the tide will turn? I mean, what do you think?
Well, I'm going to be hopeful because that's my persona as healthy thinker on Twitter and as just Jane, who was graced with a lot of love in her life. So I'm going to be optimistic. But I also have a hedge, and that is I also have a passport to Italy, for real.
So you're bailing out? That's your answer?
I'm a European citizen, which means I'm a health citizen in Europe and can get universal care in any EU country, barring the UK in this Brexit moment. So I have a hedge, but my hope, and a lot does hedge on the 2020 election. In fact, like the 2018 midterms, it will be a healthcare election. We know this. The number one topic discussed in the 3 Democratic debates. we must get to universal health care. But as I said, I have a hedge and we'll get health care in Europe. So I ain't doing this just for fun. This is my life's work, and I am an advocate for universal care. So God willing, or the fates willing, and the politics willing, we get there.
All right. The book is HealthConsuming by Jane Sarasohn-Kahn. Hey, have a look at that. All of you consumers out there can find that on Amazon, I'm sure. Jane, thank you so much for taking the time to chat with us. Thank you.
My pleasure.
I'm Jessica DaMassa with WTF Health. Thanks so much for joining us.